We are so glad you can join Breast Cancer Care WA for our second part of our webinar series on breast cancer, sexuality, menopause and women's health. My name is Emily Wilson. I'm a specialist breast care nurse here at Breast Cancer Care WA. Today, I am joined by Associate Professor Lesley Stafford. Lesley is a clinical psychologist who works predominantly with women with breast cancer. She's an associate professor at the University of Melbourne and the Melbourne School of Psychological Sciences, and she also works privately at the Royal Women's Hospital in Victoria. We are very lucky to have Lesley here presenting for us today. Once again, you can ask your questions on the right-hand side of the screen, and we'll get to those at the end of the presentation. All these sessions are recorded and they will be available for you at the end later on today. Thank you, Lesley.
Thank you. Thank you for that warm welcome, and thank you to Breast Cancer Care WA for the invitation to speak to you today. So hot flushes and night sweats, and these are really the same phenomenon, they just occur at different times of the day, affect 65 to 85% of women treated for breast cancer, often occurring while women are still adjusting to the effect of their cancer treatment. Hot flushes are more severe in the breast cancer population than in women who are otherwise healthy, and as we know, can have a very negative effect on quality of life, on mood, and on sleep. The presence of hot flushes as following on from chemotherapy or endocrine therapy also means that the experience of the flushes can sometimes reduce adherence to treatments like tamoxifen. And this is, of course, a problem for preventing recurrence. And while hormone replacement therapy is an effective treatment, it's generally contraindicated for many women with breast cancer. Other non-hormonal medical treatments can be effective, and I know that some other speakers have spoken about these treatments in other talks. And the truth is that many women who come and see me certainly would actually prefer not to have a medical treatment. And this is why I'm talking today about cognitive behavioural therapy, or CBT, which is a talking treatment. So to give you an overview of what I'm going to be speaking about today, the use of CBT, or cognitive behavioural therapy, in the management of hot flushes. Now, again, I know that one of the previous speakers covered this, but I'm going to start off with what happens when you have a hot flush, as this is really useful for understanding the CBT model. I'll talk more about CBT as we progress, and I'm going to describe a somewhat simplified CBT model of hot flushes that will become clearer as I go through the talk. I'm going to talk about CBT approaches to staying cool or cooling down, and this starts with getting to know your hot flushes and potentially making some behavioural changes. Then I'm going to give you a quick lesson in paced breathing, because this can be a really good behavioural strategy for managing flushes. Then we'll turn to the cognitive part of the CBT model, and I'll talk about focusing on your thoughts and identifying thoughts and how these may impact on how you feel. And then the very last part of my presentation is about mental health support. And I won't be talking about stress as such, but I'll be talking about differentiating stress from anxiety and depression, where to get help, and some final points on promoting and maintaining your mental health. So let's talk about what happens when you have a hot flush. Everyone has a thermoneutral zone. This is like a hot flush threshold. It's that range of temperatures your body can experience without having to actively regulate those temperatures. So body temperature goes up and goes down, and your body usually adapts without having to shiver or sweat. And this is seen in the top diagram in a woman without menopausal symptoms. Hormones are linked to body temperature, and cancer treatments reduce your levels of the hormone estrogen. So the hot flush threshold becomes narrower. This means that there is a smaller range of temperature change that your body can experience before needing to actively regulate it by sweating or shivering, like in the second picture. So that may change, that same change that was not an issue before, that same change in temperature that wasn't an issue before, now triggers a hot flush or a night sweat. And what's very important to understand is that stress also narrows that zone. Being stressed or anxious also tends to increase the frequency and the intensity of a hot flush. But the good news is that eventually the body does adjust to hormonal changes and the hot flushes and the sweats do dissipate. So let's come back to the cognitive behavioural model. Simply, the cognitive component is how we think about hot flushes, and how we think about hot flushes affects our emotions or how we feel. The behavioural component deals with how behaviour can be changed to promote better symptom management. And all of this will become clearer as we go through the talk. In this diagram, I'm showing you that your physical symptoms or sensations, your behaviours, your thoughts, and your feelings all feed into each other to produce your response to a hot flush. And because these components are so interrelated, it follows that by changing just one thing in one of those components of the model, you have the potential to change the entire response. And again, this will become a little bit clearer, I hope a lot clearer, as we progress through the presentation. So in this next slide, I've added a bit of detail. I've added some examples. So you might notice, say, having physical sensations in a hot flush, like feeling hot or sweaty or shallow breathing. And then you interpret those sensations. In other words, you have a thought about those sensations. And that thought could be something like, oh gosh, this is intolerable, or I can't cope, or everybody's looking at me. Once you think that, you might then in turn feel embarrassed or frustrated or worried, which leads to a behaviour like fanning your face, or if you're at a party, leaving that party, or if you're at a shopping centre, going home, and then in the future avoiding those places. So you could also see then how by leaving the party and going outside into the cool air, you might feel cooler or less sweaty, which you would then interpret to mean as this method works, and hey, I'll do this again in the future, and you would feel more relaxed. So there are lots of ways for these components to interact, but the key issue again here is that changing just one component does have the potential to change the whole experience. I'm now going to talk through some of the cognitive behavioural approaches to keeping cool or to cooling down. And the first one is getting to know your hot flushes. And the first part of getting to know your hot flushes means asking yourself 3 questions. How often do I have hot flushes? Is it once a day, 10 times a day, 50 times a day? 2, how severe or intense is my hot flush on a scale of 0 to 100, with 100 being the worst? And 3, how much does the hot flush bother me or impact on my functioning or interfere with my daily life? And your hot flushes may vary. Some may be more intense or bothersome than others, and you may have more hot flushes on some days than on other days. Now, the reason I'm asking you to do this is so that you have a baseline from which to work, because I'm going to invite you to try a few strategies, and this is one way of testing whether those strategies are actually helpful for you. I've noticed that some women can have 20 flushes in a day, but those flushes are quite mild, and so they're not very bothered by them. Whereas others can have 2 a day, but they're very intense and the impact on their functioning is quite dramatic. So what we're aiming for is a reduction in how much you are bothered by your hot flush. And this can come from either a reduced frequency in a day or reduced severity of that hot flush. The second part of getting to know your hot flushes is identifying your triggers. Some of the well-known triggers include alcohol, caffeine, hot or spicy food, a rapid change in temperature, hot or crowded spaces, feeling stressed or distressed, and rushing. So now, if we go back to the model that I described earlier, we can add these bits of information to the interacting components, because we now know that these physical sensations and thoughts and feelings and behaviors are occurring on a background of a reduced hot flush threshold, your thoughts or perceptions of the severity and the interference of the hot flush, and also in the context of a range of potential triggers like stress and anxiety. The next part of getting to know your hot flushes is to keep a diary with the time and day, the hot flush severity and its impact, and importantly, what was happening when that hot flush occurred. So have a look at the sample diary, and I've written out 4 examples. So 7 a.m. on Tuesday morning, the hot flush severity was 75 out of 100, and the impact on me was 45 out of 100. And what was I doing at the time? I was at home having morning coffee. 8:30 on Tuesday, the severity was 80, the impact was 85, and I was in my car in a traffic jam running late for work. At noon on Tuesday, the severity was 40, but the impact was 100. What was I doing? I was in a work meeting with a new client. And that night, Tuesday, 9:30 p.m., 50 and 50 in severity and impact respectively. And in bed, I couldn't fall asleep. I was getting really irritated. So is it possible, if we look at these triggers, that caffeine or the heat of the coffee was the trigger for the first hot flush? For the second, could it have been that rushing or perhaps the heating was on in the car? Could that have triggered the hot flush? For the third, could it also have been there was a lack of cooling in the room, or you were feeling anxious about impressing your new client? And for the fourth, what was the sleeping environment like? What is the effect of becoming irritated on a hot flush? And I hope you're getting the picture now that being irritated and irritable, anxious or stressed does increase the intensity of a hot flush. So I'd like you to ask yourself, what are your triggers? And are there relatively simple lifestyle or behavioural changes that you can make? Here are some ideas, some relatively simple ideas that you could take on for keeping cool or for cooling down. So simply you could cut down on caffeine and alcohol, or you could consider swapping them for a different beverage. Taking sips of cool water and keeping a bottle of cool water with you can be very helpful. Wearing light clothing that's easy to remove, and wearing clothing that's loosely fitted and made of natural fibres is also helpful. Certainly having a small portable fan on your desk, and certainly where I work, most women do have a little fan on their desk, and that's just how it is. That can be useful too. When it comes to sleep, really think about your sleeping environment. Choose cotton sheets with a low thread count if you can. Get rid of those heavy blankets. Reduce the light and the noise in your room, and keep your room very well ventilated. Some women have also found it really useful to use a chillo pillow, which is essentially a pillow that's made from gel that stays cool all night. So you may need to just experiment a little bit to find something that works for you. All right, so the next behavioural strategy that I would like to talk to you about is called paced breathing. And some of you may have come across this before. So what is paced breathing? Paced breathing is a slow, controlled breathing from your diaphragm, where the goal is to replace chest breathing, and by chest breathing I mean quick and shallow breathing, to replace that with abdominal breathing, which is deep and slow. And we do know that paced breathing can reduce the duration and the intensity of a hot flush. So how do you know what kind of breathing you're doing? With shallow breathing, your chest and shoulders will rise and fall typically. And with abdominal breathing, your diaphragm is moving downwards and your tummy tends to rise. So what you could do now is you could place one hand on your chest and one hand on your tummy and just notice which hand is rising as you breathe normally. If the hand on the chest rises more, then you're chest breathing. If the hand on your tummy rises more, then you're diaphragmatic breathing. So the diaphragm is this large dome-shaped muscle at the base of the lungs. And by breathing through the diaphragm, we are helping to use our diaphragm correctly. So remembering those instructions, placing one hand on your upper chest and the other on your tummy or just below your rib cage. And that allows you to feel your diaphragm as you breathe. So breathing in slowly through your nose so that your tummy moves out against your hand and the hand on your chest would remain as still as possible. And when you breathe out, you're tightening your tummy muscles and sort of letting them fall inward, and the hand on your chest still remains as still as possible. And when you first learn this technique, it's sometimes easier to learn it lying down with your knees supported by a pillow and also your head supported. So that's a bit about diaphragmatic breathing, and how do we use that in the context of paced breathing? So once you have the hang of that diaphragmatic or deep breathing, I then invite you to try this in a paced method. So what you're going to do is inhale slowly through your nose to the count of 5, remembering that your tummy should be moving out against your hand, and then you pause for a moment. Then you exhale slowly out of your mouth using pursed lips, if that's helpful for you, again to the count of 5, and letting your tummy muscles fall inward. So the hand on the chest must move as little as possible, and then pause for a moment. And you repeat this for 10 cycles or until your symptoms pass. And the reason I have this in the shape of a rectangle is because some people find it really useful to visualize the rectangle in their mind while they're doing the counting. Because really what you want is to keep your breathing smooth and regular. So if I could encourage you to practice a few times a day, ideally practicing when you're feeling calm, when you're not having a hot flush, so that as you become more comfortable with this practice and with this technique, you're able to implement it at the first signs of a hot flush. All right, so let's pull out the diary again, because one of the reasons you're having a diary is to keep a record of the impact of your paced breathing on your hot flushes. And so that might look something like this example, where you're hoping that the severity and the impact will both reduce, like they have in example 1, where after 3 minutes of practicing paced breathing, the hot flush severity has gone from 75 to 61, and the impact has gone from 45 to 30. With the second one, you can see the severity of the hot flush has gone down a lot, but the impact hasn't gone down so much. So breathing on its own might actually not be enough in this instance. But wait, there's more. So now we've talked about getting to know your hot flushes, and we've talked about paced breathing. We're now going to talk about the cognitive component, and that is addressing thinking patterns. I think most of the people on the webinar today will recognise that thoughts about hot flushes are seldom positive. And women worry about the reactions of others, loss of control, and the impact of hot flushes on their daily functioning, often making predictions about what's going to happen as a result of this hot flush. For example, I'm going to be a wreck tomorrow. We also tend to catastrophize about hot flushes, think the absolute worst. And research shows that this is associated with higher levels of distress. Being very self-critical is also associated with higher levels of distress in the context of hot flushes. So now I'm going to take you back to the diary. All right. And another part of getting to know your hot flushes is the role of your thoughts. And I'm inviting you to identify your thoughts at the time of the hot flush. So picking up on the examples that we had before, the one at home at 7 a.m. where you're having your morning coffee, the thought might be, gosh, oh no, really, again, this is a disastrous start to the day. When you were in your car on the way to work, running late in the traffic jam, the thought might have been, I didn't bring a spare blouse. I can already smell my sweat. I'm going to be really smelly all day, and so on. So you can see that these are the sorts of thoughts that people are likely to have in response to hot flushes. So the next thing I want you to do with this diary and with the thoughts is to notice the emotion that comes after the thought. How did you feel? Again, have a look at the examples that we've been working with. And it's quite understandable that one would feel stressed or embarrassed or hopeless or worried with these kinds of thoughts. It's really hard to imagine feeling joyful or even neutral when your thought is that you'll never be able to cope, or that the person sitting opposite you thinks that you're a complete idiot, or something like that. Now, the next step in this process then is, okay, we've identified what we were thinking, we've noted the impact on our feelings of that thought. Can we potentially interpret this whole experience in a different way? Is there another interpretation of the situation? Is there a more helpful or a kinder or a gentler thought that I could substitute for the thought that I initially had? So, for example, instead of thinking, this client must think I'm mad or completely incompetent, what about if I take a step back and go, I'm actually mind reading. I don't know what the client is really thinking. I'm being really self-critical. Or in the example of being in bed and not being able to get to sleep and feeling irritated, where the thought was, there's no way I'm going to be able to function tomorrow. I can't cope with this. What if you kind of said to yourself, hey, I'm catastrophizing and making a prediction. So if we then substitute those thoughts in the first case with something like, I actually notice my hot flushes more than anyone else does. I'm good at my job, and who knows what she's thinking. Or in the second example, to say, well, let's see how I can cope with this one. There are things that I can do that will help, and I've managed on very little sleep in the past. I'll be okay. So the principle obviously then is that the more helpful or gentle or kind the thought, the calmer the emotions will be that follow that thought. And you could measure the impact or the benefit of this process of substituting these less helpful thoughts with more helpful thoughts and rating your level of distress by using your diary. So you could rate the level of distress before and after. So in this example, when I thought the client must think I'm incompetent, the level of distress was 85 out of 100. But when I was a little kinder to myself and sort of said, well, I'm good at my job and who knows what she's thinking, this won't last forever, then my distress dropped to 45 out of 100. So maybe with the addition of some breathing as well, that rating would have been even lower. And here are some suggestions for you when you are examining your thoughts. The first is to hold yourself kindly. Ask yourself, what would a caring friend say to you in this situation? Or what would you say to a friend? Would you say to a friend, gosh, your client must have thought you were incompetent? You probably wouldn't. What would you be as critical of a friend as you are of yourself? You can also ask yourself, is there another way to look at the situation? Am I mind reading? Am I predicting the worst possible outcome? And am I focusing all of my attention on this hot flush, but ignoring everything else about the situation around me? Okay, so we've talked about getting to know your hot flushes, using the diary paste and diaphragmatic breathing, looking at your thinking patterns. And so now we come to the last part of the talk. And I've said that stress does have a big role in managing hot flushes, but I'm not actually going to be giving another talk today about how to manage stress. Instead, I wanted to use this opportunity to really point out the difference between feeling stressed and being clinically depressed or anxious, and when you should get help from a formal mental health professional. So quite often I'm asked, is stress the same as anxiety? Is stress the same as depression? Or I'm asked, how much anxiety is too much anxiety? How much is normal? Now, normal anxiety is feeling stressed or worried under pressure, and certainly there's plenty of that when you've had a diagnosis of breast cancer. But the feeling passes, and the thoughts or the feelings or the behaviours that are associated with your anxiety don't have a really significant impact on your day-to-day life. They don't control you. But please consider seeking support when you have worry that is really difficult to control, you have episodes of intense fear or ongoing really upsetting dreams, or you have difficulty making decisions or attending social situations, or if you find you're using alcohol or drugs to manage your feelings. In relation to depression, again, it's quite normal to have ups and downs and to feel irritable or sad or frustrated sometimes, just as long as those thoughts and feelings don't have a significant impact on your day-to-day life. When you do need to seek mental health support is when these feelings of sadness are intense and enduring. So if you're feeling miserable most of the time for more than a couple of weeks, you need to get some support. Another key issue that's often overlooked is losing interest or not being able to take pleasure in usual activities. Now, of course, I recognize that there may not be as many activities that you can participate in if you are unwell, or indeed during COVID, particularly here in Melbourne. But the key thing is whether you still have that capacity to experience pleasure and have fun. Other key signs to watch out for are withdrawing from your friends and family, feeling constantly overwhelmed or indecisive, and again, using alcohol or drugs to manage your feelings. Certainly, if you find you're having thoughts like you're a failure or your life is not worth living, or any thoughts of harming yourself, please do seek support as a matter of priority. I've put together a little slide here about some of the myths and the facts about depression and other forms of mental illness. So I often hear the view that depression is a weakness and that antidepressant medication is addictive or it changes your personality and so on. The fact is that depression is an illness, and it's one that can require medication sometimes, which in turn requires medical supervision, just like any other illness. I also hear sometimes that seeking help is a sign of weakness, but of course it's not. It's actually a sign of strength and adaptation. Some women tell me that they've waited a long time to access help because there's nothing that can be done about depression and anxiety. And this is not true. There are very many depression and anxiety treatments that are effective and available from a range of resources. And I will talk about that in a minute. Finally, I really want you to take home the message that taking care of your mental health is not a luxury. Your physical health, while important, is not everything. Mental health is actually not just an optional bonus. It is an integral part of your recovery and your quality of life. So in case you're wondering which professionals can support your mental health, if you're still engaged with a hospital, then your breast care nurse is often a good place to start. Your first point of contact in the community is likely to be your GP, and your GP can assess your concerns, discuss and prescribe lots of treatments, and make appropriate referrals if needed. Some GPs do provide brief counselling or therapy, and they certainly do prescribe medication. A GP can also refer you to see a psychologist under a mental health care plan. And currently, due to COVID, we can access 20 Medicare rebatable sessions a year. Or if you have private health insurance, you may be able to get some money back from that. A GP can also refer you to a psychiatrist. Now, one of the few benefits of COVID is that telehealth has become the norm. And that means that it does open up options for you to see someone who would otherwise be a long drive away from you, or someone who is in fact in another state. And I've listed 2 websites here where you can search for psychologists in your area or indeed nationally who would offer telehealth services. Of course, lots of people don't actually require, I would say the vast majority of people don't require formal support. They are fine to self-manage, to talk to friends and family, and get support from groups and online forums. And so here are some of the community resources that I'm sure you're aware of. And I encourage you to go online, investigate, because there is actually quite a lot of information and support available online. In terms of self-help, I can recommend these 2 resources. One specifically for managing hot flushes, based on quite a bit of evidence, and very effective. And the other is a book about self-compassion. And you'll recall I spoke earlier about holding yourself kindly, about having kinder, more gentle thoughts about yourself. And that's the idea of self-compassion. So these are 2 books you can order from Amazon or have a look at your local bookseller, and they may have them available. If your shops are open, that is. All right, brings me to my final slide, and I want to leave you with some thoughts on promoting and maintaining your mental health. Well, first of all, can I encourage you to speak up? Don't say that you are fine when in fact you are not, because even the best psychologist, the best nurse, the best oncologist is actually not a very good mind reader. And second, accept help if it is offered. Next time someone says, is there something I can do for you? Say, yes, actually there is. Third, please be informed but judicious about the source of your information, and get the advice from the most informed, reliable sources that you can. I encourage you to exercise. Now, you don't need to train for a marathon, but do get moving, because this has very well established beneficial effects for your mental and your physical health. Now, I've talked a bit about self-compassion. And again, this means being warm and understanding towards ourselves when we suffer, when we fail, when we feel inadequate, rather than ignoring our pain or beating ourselves up about it. And I've recommended that book for you to have a look at. When you are self-compassionate, you recognize that suffering is part of the shared human experience, and it's something that we all go through rather than being something that happens only to me or only to you. When you have self-compassion, you also often have an awareness of your thoughts and your feelings in a way that you can just observe them as they are without trying to deny them or suppress them. So what I mean is that it's not really possible for you to ignore your suffering and feel compassion for yourself at the same time. Another good part of mental health, or another part of good mental health, I should say, is the notion of willingness or acceptance. And what I mean by this is leaning in. So by acceptance, I don't mean being resigned or feeling self-defeated, which implies that something is being done to you in all of this. Instead, I mean an acceptance or a willingness as a choice you make to allow the presence of difficult, painful feelings and thoughts and sensations without trying to fight them or struggle against them too much. So this type of willingness or acceptance can be very powerful, particularly when you are committed to living life in pursuit of the things that you value, however long or short your life is. Now, also, of course, I encourage you to have goals, but they need to be realistic and achievable goals, and you must pace yourself or let someone else help you with pacing. Otherwise, and I see this so often, women set themselves up for failure. I invite you, knowing how difficult it is, to focus on the things that you can control and less on the things you cannot control. And again, I know this is easier said than done, but perhaps you could work with someone like a psychologist towards this goal. Finally, just a word on gratitude. There is actually quite a big evidence base now about the benefits of gratitude for mental health. And if you're recovering from a breast cancer diagnosis, you may be feeling that you don't have terribly much for which to be grateful. And certainly few are grateful for a cancer diagnosis. But perhaps, I guess, to also think about those aspects of your life for which you do have gratitude. And that could be a loving partner or healthy children, or, living in a first world country with access to good medicine. And maybe consider what it might be like not to have these things in your life. So that brings me to the end of my presentation. I hope that it has been helpful in some ways to provide you with both some behavioural and some cognitive strategies to manage your hot flushes. And I wish you all the very best. I'm happy to take questions.
Thank you so much, Lesley. That was absolutely fantastic. And thank you for joining us from the other side of the country. First question is, can you tell us a little bit about your role and your work and what you do in Melbourne?
So I have my predominant role is at the Royal Women's Hospital, where I'm head of clinical psychology in the mental health service. And my clinical job in the hospital is really looking after women diagnosed with breast cancer or women at risk of breast cancer. So women who perhaps have a genetic predisposition or who come from families with lots of cases of breast or ovarian cancer. And then I have a research portfolio that accompanies that interest. And more recently, I have started working privately as well in the community.
And if patients from Western Australia wanted to see you, do you offer telehealth appointments?
I do offer telehealth appointments. I mean, I think, ideally one would like to see somebody in person to get a sense of what that person is like and whether they're the right fit for you. But I think having service via telehealth is better than having no service at all. And it has lots of advantages. So yes, certainly I would be able to accept referrals.
Great. The next question is a follow-on from that almost, is would you recommend the services of a specialised counsellor in breast care services to help people with all of this as well?
So do you mean recommend the services of a specialised counsellor for the treatment of hot flushes? Is that what you meant?
Flushes and also other menopausal symptoms.
Yeah. Look, the mechanics of treating somebody for hot flushes using cognitive behavioural therapy can be done, I think, by any good psychologist or any good clinician who's had some training in CBT. The principles are the same. So I don't think it's absolutely essential that you see somebody who specialises in breast cancer. I think it's often helpful that you see someone like that if you can, because they understand the context, they understand the language, the experience. But the actual skill involved in providing that treatment can be provided by others who don't work in that specialist area.
That's great. Thank you very much. I know you gave us the resource of the Myra Hunter booklet for women. Do you have any other resources that you'd recommend that women could access?
Well, it depends really what they're looking for. So there is a self-help resource for just about everything these days. So, you know, if you go onto Amazon and type in whatever your concern is, anxiety, intrusive thoughts, low mood, as well as some of the more specific sort of breast cancer menopausal symptoms, whether those are around sexual functioning or other changes, sleep. There is a self-help book for just about everything. So I think I'm hard-pressed to recommend some now. The two I recommended, I know, are evidence-based and by very respected authors. So I'm happy to recommend those.
Cool. Have you personally had experience with the group-based therapy that Myra Hunter developed?
No, so I've never run Myra Hunter's group-based therapy, but I have treated lots and lots of patients individually using CBT, and the CBT techniques that I use are the same ones that Myra and her colleague have used. So what these sort of group therapy programs do is, in a case like Myra's, is they pull together in a really useful way bits and pieces from everywhere and package it up and then go and test it in large numbers of people. And that's what Myra's group have done. Yeah.
Over what time period would you notice a change in symptoms with the CBT? Is there a set, or is it everyone's different, obviously? Or
everyone's different, and there's also a dose response. So the more you practice, generally, the faster and the more effective the treatment will be. Having said that, CBT doesn't work for everybody.
Yeah.
So, you know, it can maybe sometimes get you halfway, and for some people that's enough. And for other people, they may then consider something else, like taking one of the SSRIs or something else down the track. But it certainly doesn't work for everybody, or it might work kind of, you might like the idea of it, but then not really want to practice paced breathing in, you know, or want to keep the diary or anything like that. So there is a dose response in that sense.
Okay, great. Thank you. One of the final questions is from a lady who's asked, her hot flushes mainly occur at night time while she's sleeping. What could her triggers potentially be?
Well, there's the obvious sort of suspects, which are the, you know, has she had a hot drink or a hot shower just before bed? Is the room cool? Has she got only a light sheet on? You know, the kind of layers that you would wear in your clothing, to have those layers on the bed as well so that you can very easily strip off things. Is the light and the noise at a minimum? So that's the sort of, you know, the one aspect of it. The other is, you know, how tense, how anxious, how stressed are you? It takes a bit of practice using the CBT approach to kind of stop and say, what am I actually thinking? What's going on here? And that's where the diary is useful. So chances are that at night it's one of those kind of contextual factors in the bedroom, but there's also the chance that at night that there is that kind of, you know, it's the end of the day and we're thinking and worrying about about tomorrow, the next day, or things we have to do. And that kind of feeds into the intensity of a flush or a night sweat.
Great. Thank you so much. Well, I think that's all of the questions that we've got for today. Thank you so very much for joining us from the other side of the country. We really, really appreciate it. We're very thankful for you. So thank you so much.
You're welcome. You're
We
welcome.
enjoy hearing your puppies barking in the background as well.
Oh, look, I wondered about that. And I'm sorry, but sorry.
No. Thank you so much. I will just remind everyone that we have support groups here at Breast Cancer Care WA as well. And we do have counsellors, which you're very welcome to access at any time. So thank you so much, Lesley. We hope that you have a lovely day. Thank you so much for joining us. You've been an absolute delight. Thank you.
Okay. Bye.
Thank you. Bye. Oh, yeah. Our next session, we'll just take a 5-minute break, and then Judith Thompson is going to join us for our next session. So you can exit this screen and go back to the home screen. Thank you. Thank you, everyone.